Hey pups and peeps, Angie Woods with Dog Psychology 101. Today we have a health issue to talk about, and February is dental month. So most of you have read through my stuff. You know that I spent 17 years as a veterinary technician. So this is lives true and blue to my heart. Pardon the rooster, we're on the farm, okay? If you're new to our channel, please be sure to drop us a like and hit the subscribe button below. You'll be the first in line to receive our new videos. So February is dental month, and this is really important. Dental health affects everything, especially if you have a small dog. These guys are really prone to dental issues. They tend to get a lot of tartar and periodontal disease and lose teeth faster than larger dogs. So we should be checking our dog's teeth on the regular basis and just being sure that they are not having tartar buildup. So if they are having some tartar buildup on their teeth, the first thing we want to look for is, do you see a red line at their gum line? And if so, if we're already starting to see a red line, that means that we have gingivitis. And gingivitis, just like we people, is the very first sign that something needs our attention. So definitely take your pup in and have that examined if so. Sometimes that can be treated before a larger dental is necessary. But let's say that your dog's teeth are already in really bad shape. You're noticing really bad breath and you know something's going on. So if you take a peek at the molars or even the canines, and if you start to see something that kind of looks like barnacles growing on there and things are really heavy plaque and built up, you might even see some recession of the gum, and you might even see some pus at the gum line. This is what we call periodontal disease. And there are different stages of periodontal disease. You know, the latter stages, the teeth are falling out. And not only are the teeth falling out if we let it go this long, but there's bone loss in the jaw and the bones that are holding the teeth in. So it's really important that we stay up on dental health, not only for the teeth, but when they are swallowing bacteria. It is affecting the heart, the liver, the kidneys, even the pancreas. It affects everything. Now, if your dog has a heart issue or an issue with any of their other organs, we want to really be sure that it is safe to go ahead and do a dental with them. And of course, you'll talk to your veterinarian about all these details. But in short order, dental health is as important as anything else. And I know you care about your kids. We feed them the best food. We take the best care of them. Don't hesitate to go get their teeth cleaned. Many people express to me that they're worried about anesthesia. This is why we do blood work on the front side, to be sure that everybody can handle the anesthesia coming through their system. But most veterinarians now in America use the same anesthetics as we use for people, and it is extraordinarily safe. Dogs do sometimes pass on the table, just like some people do, and it's really, really bad when it happens, and it's horrible. And I feel your loss if that ever happens to you. I've had the experience, but it's really rare. And don't let that hold you back from having a healthy dog. Some dogs need their teeth cleaned every year. If you have a small breed dog, it might be more than once a year. But if we do it safely, everything will be fine. Sometimes if your dog has very bad dental disease, talk to your veterinarian. They will give your dog antibiotics before the procedure for several days. And this will help prepare their body for the bacteria that's going to be cut loose during the procedure. Since dental month is in February, almost every veterinarian has a special in February for dental cleanings, typically about 20% off. So be sure to ask your veterinarian if there's a discount. Some other products we might consider when we're thinking about our dog's dental health would be some dental chews. So not a particular name brand, but if you're thinking about consumable dental chews, I do want to have just a little bit of a warning here. There has been some cases where dogs swallow too much of those, and they can cause an obstruction or other digestive issues. So be a little bit careful with dental chews. Now, there are some dental bones. We love Nylabones, and Nylabone has some special chews that have little knobbies on them to help clean the dog's teeth. Now, some of the best times to offer these things to your dog are after a meal, so that they take the time to sit down and get all of the food off their teeth. Some dogs are cleaner than others. They take the time to lick and clean and tend to themselves after a meal, and some dogs don't. So we can help them out by offering some of these products to them. So everybody, I know you want a healthy kid. You don't like the bad breath, but even worse, it's the diseases that it causes above and beyond just the teeth. All right, so talk to your local vet. There are some products on the market. CET is one. They make raw hides if you're okay with raw hides. They also make some liquids that help dissipate that tartar if we start it maybe right after a fresh dental, or if you don't have tartar already. There's enzymes that eat those little bugs in there. So there are things we can do. And you can also brush your dog's teeth if they tolerate it. If not, you can work on that. But the enzymes and the brushing, and get in there, let's start back from zero. All right, we'll see you next time. Happy Dental Month. Smile.